So we're looking at shoulder pain and shoulder impingement. So basically what impingement is where when you raise your arm up, you're actually pinching your rotator cuff. And this is something that we've already talked about. Some of the things that we do to test it, we look to see, can we bring your arm across your body? And normally, Jim here has a shoulder problem, normally should be able to get all the way across and choke yourself basically. And there's a significant amount of limitation. So immediately, so go ahead and raise your arm up for me, Jim. So there's a limitation in shoulder motion, and the mechanics, how the shoulder is moving, is off. The shoulder movement is guided by your collarbone, the rotation and spin and glide of your ball and socket in the humeral joint, and then your shoulder blade and how that has a specific movement which is different than your arm bone, the humerus, as it relates to the shoulder blade. Okay? So right now we do have a shoulder problem. Let's say Jim is in a lot of pain and he's having trouble sleeping at night, can't sleep on this side. Here's some of the things that you can do to relieve some of that pain. Now, one of the things, and he's already doing it to a certain extent, if your arm is out to the side, you're actually reducing tension on the supraspinatus and the rotator cuff. Now, what you can do is you can have a pillow and just prop it up. This looks familiar if you've ever seen anyone that's had shoulder surgery. They have a pillow on the sling to push the arm out. That is to reduce tension on the rotator cuff tendons, because without that, as the arm drops down, it actually pulls that tendon and compresses it, reducing the blood flow to that tendon. Now, inflammation already is going to weaken the tissue structures and put you at a higher risk for a tear. Reducing the inflammation and getting the pain down is one of the first things we want to do. We're going to start by mobilizing and using manipulation techniques to get the shoulder moving, and then we're going to do certain techniques like oscillations and different techniques to reduce inflammation. Sometimes a steroid injection into the joint or near the joint. We have two options. We can go into the joint itself or into the subacromial space where the rotator cuff lies. And either one is dependent on where the inflammation is residing. We can determine where your inflammation is by doing a diagnostic ultrasound. Okay? So if you've not had a diagnostic ultrasound and you have trouble sleeping on the shoulder, pain at night, you have that painful arc of movement, a diagnostic ultrasound is a very good thing to have done. Let your therapist know that that's something that you would like as part of your care. All right? So that's supporting, taking time throughout the day. Now, the other thing that we can look at is when you're sleeping on your shoulder, having a pillow top or something squishy enough to reduce some of the tension. The other is making sure when you're sleeping that your head is supported, that you have enough pillows to fill in the space from the shoulder to the head. And then having a folded towel or a pillow between the hips and up against the rib cage, that can reduce pressure on that shoulder as well, or just over on the other side. Now, if you're on the other side, you can then sleep with the pillow, kind of hugging a pillow to reduce some of that tension as well, okay? So those are some of the things to look at when you're trying to reduce some of the pain. And we're going to continue to move forward to specific exercises that you can do later on.